I am Dr. Margaret Rague, and you are listening to Empire Radio. I'm a doctor of naturopathic medicine. Naturopathic medicine is a combination of botanical medicine, homeopathy, hydrotherapy, counseling, oriental medicine, diet, nutrition, exercise, and many other elements. Well, it's a nice first attempt. They're certainly not physicians. They can tell people how to do exercises and eat well to a point. I'm not even sure well, I'm sure they don't understand nutrition, but they have a dabbling in it. But I certainly wouldn't call them in any way comparable to seeing a naturopathic physician. The most important aspect of naturopathic medicine is the concept of the vital force, that the body is inherently healthy, and if you give it the proper prompts, it will go back to its native health. Well, first of all, a patient can expect to get a complete interview by me. My fill-out questionnaire is 9 pages long, so I learn everything there is to learn about the patient from a paper that they fill out. It'd probably take them an hour to do that. I learn their family history, their complete history, if they have any food allergies or sensitivities, and then from there, I decide what tests to run on them. We have our own, in addition to regular blood tests and urine tests, we have our own scientific tests that will test them for food sensitivities, as well as allergies, toxins in their body, buildup of heavy metals, and also nutritional deficits. We can take their blood and see if they're missing certain amino acids, if they're missing certain vitamins, certain minerals. So then we have a sense of a picture of the components in the body that are there for their health. We can also do things like check their cortisol patterns. A medical doctor will test your saliva for cortisol, 1 measure of cortisol. That's really a worthless thing. We take 4 measurements of cortisol so we can see your circadian rhythm. And a lot of Americans suffer from insomnia, and this shows you what's going on in terms of the body's alert system, alert, sleep, rest system. Okay, this is a very complicated subject because you're diurnal. I think everybody is different, and that's another thing about naturopathic medicine. No, there is no one person, there is no one type. Each and every individual is their own person. So you may very well be diurnal, someone else may be nocturnal. It depends on that person, who they are. Now there's studies of sleep are showing that actually most people, and historically, sleep best with packets of sleep, maybe 3 to 4 hours, and then you're up for an hour or 2, and then another 3 to 4 hours, which tells you right then and there the 9 to 5 work shift is very bad for your health, because you cannot fit 4, 2, and 4, 10 together in with a 9 to 5 work shift. It doesn't work. So right away, the labor hours of the United States are designed to destroy health. Well, it is their fault. I take issue with that, because you have to take responsibility. Each and every one of us must take responsibility for our health. I hear every excuse under the sun as to why people cannot take responsibility for their health. You do not have to buy McDonald's at lunch. You can take with you a packet of nuts and seeds and an orange. You can bring some sliced vegetables with you. It's not a matter, I don't believe it's a matter of economics. I don't believe it's a matter of you're forced to do it. I think if you want to be healthy, you can be healthy. It's a choice. certainly in the United States of America, it's a choice. We are not a food insufficient society. Other places in the world where people are dying of starvation, they can say, I can't have a healthy diet because, you know, the earth and the environment doesn't afford it to me. But nobody in the United States of America can say that. You can dumpster dive and probably eat healthily in the United States. So I think it's about time for the American public to take responsibility for their own health. Well, it started in my brain. You know, just learning how to think. Unfortunately, most people don't think for themselves in this country. You have to learn to think for yourself. And I think that's very, very, very important. Where did I learn? I would say I learned, first of all, by observation, looking around me, looking at the world, and then reflecting. Do I believe this? Do I believe this? What do I think? What do I think of this? You know, and I remember being in kindergarten, actually, I have a very vivid memory of this because they were testing us for what track. I came from a tracking system, and it went all the way from the slow kids to the honors children. And I remember being given an IQ test when I was 5 years old. I was a little child. They put me on a bench, a stool. I stood up, and they showed me 3 boxes, and they said, which is the little box, which is the littler box, and which is the littlest box? And I remember looking at them and thinking, could it possibly be that they're so stupid that they don't know the answer to this? And so testing them to see if they really didn't know this. And as I tested them, I said, I picked the littler box, and I said, well, this is a little box. And then I looked at them, and they were looking at each other. As a result of this, I got put in the slow track because I was testing them as they were testing me. And I think that's very important to do. Always test the people in authority, because the only authority is knowledge and truth, study, self-examination, examination of others, and then arriving at some kind of conclusion, intellectual and emotional conclusion, or at least assumptive conclusion, until it's corrected by even better information. And I think there's not nearly enough of that in American society. We have been so dumbed down that people graduating, it used to be when I graduated from high school, a high school degree was actually worth something. The college, I've seen people come out with masters now who don't have the equivalent of the education that I had in the 10th grade. And that is very, very disturbing to me, very disturbing. The average American cannot think. But, and I was just listening to a radio show on this, the death of expertise. They will not defer to any kind of expertise, whether it's actually authoritative or not, and steeped in great knowledge, because now is the new age of angry narcissism. Everybody's as good as everybody else. Everybody's view is as equal as everybody else. And so you get a lot of Americans who have based views on pure prejudice or their one life experience, which isn't really revelatory of much of anything except, you know, frankly, a very narrow experience. And they've now dubbed themselves experts. So we have the new thing, the ignorant expert. And it's really a very difficult thing to argue with the ignorant expert, because A, they're ignorant, and B, they think they're experts. So this is a real problem we have in American society. We have, first of all, we have to go back to reading. Get off the internet. I mean, I hate to say this is on the internet, but you know, people have to read. There's something about reading that really informs the brain. Reading is very, very important. And this new awful thing where they've cut out cursive, this is terrible, because the schools no longer teach cursive. Cursive is, in my opinion, the fount of creativity. You have to take thought and then you smoothly write your thought out on the page. And so as you do that, you're really thinking, you're expressing yourself. And then when you read, you have to take somebody else's point of view. You have to bring it before your brain and you have to process it. And that all is prompting interaction between the person and the page, and the person who's expressing what's on the page. And that's very, very important for actual learning. And we have to remain humble, because we only know what we know. That's all we know. And there's billions of people out there, and every single person knows something else different that we don't know. So we always have to listen, because that's how we will just constantly learn from one another. Because I have always seen it very distressing in a different light. To me, it's a form of envy. And I think envy is very evil, very, very evil, because what you're saying is, you got something, and because I don't want it, you shouldn't have it. That's very mean. When somebody else gets something, you should be happy for them because they got something. That was a joy that the universe or they or, collectively was bestowed upon them. And that's a joy. And it should be a joy for everyone. And then you'll get your turn, and maybe, okay, not everybody gets the same, because life isn't fair in the final analysis, but so what? Just enjoy it and take pleasure in what you get and take pleasure in what other people get, and stop worrying about what that guy has and you don't have. That's just dumb. I went to a public high school on Long Island, and then I went to Vassar. I was in a 3-year program at Vassar College, and at the end of my 2nd year, I went on the 10-college exchange with Wesleyan University. And then I took a leave of absence and went out to the Shunryu Suzuki Zen Studies Center. It's a seminary, and I was there all told for a period of 4 years. I went to the seminary, and then I spent almost 2 years in the monastery. And then I did my 3rd year at University of California at Berkeley, where I got my bachelor's degree in psychology. And then I went to New York University School of Law. I got my Juris Doctorate degree, so I'm an attorney. And I practiced law full-time, and then part-time I was raising my 2 sons. And then I went to the University of Bridgeport. Well, then I went to Yale and UConn and did my pre-medical work. Plus I did extra courses in genetics, nucleic acids, and a few other things. And then I got my doctoral degree in naturopathic medicine from the University of Bridgeport College of Naturopathic Medicine. 2011. Yeah, but I did an internship for the last 3 years. It's normally a 4-year program, but because I had 2 sons, and because in the beginning I was practicing law, and because frankly I was not in my 20s like the rest of the class, I said, I looked at this program, which is an incredibly difficult program. We take all the courses, all the academic courses that medical doctors take. They take 5 to 6 classes per semester. We take 11 to 13 classes per semester. So on top of all their classes, we take all our naturopathic medical classes. So it's an extremely demanding, challenging program. And then we do our internship within that 4-year period. So you can only imagine the physical and academic challenge that is before the naturopathic medical student. So I looked at that program. I said, there's no way I'm doing this in 4 years. I'll do it in 6 years. And they accepted me on that basis. And so it took me 6 years. And the last 3 years, I did my internship. So I was practicing medicine, but I didn't yet have my license, as I do now, to practice medicine. I was training under the auspices of licensed naturopathic physicians. Yeah, I think chiropractor is very useful. I think unfortunately I lost my chiropractor. That's another story, but I have another chiropractor. If I'm desperate, I go to a chiropractor. I think chiropractors have a useful endeavor that they engage in. I know several times I've had vertebrae knocked out of place, and without my chiropractor I couldn't even breathe properly. So I think chiropractors are very useful, and some of them are actually, trained in nutrition, and yes, I think chiropractors are fine. I mean, they don't provide the full panoply of medical services. So you should never, I don't think, or unless it's a highly unusual chiropractor, go to a chiropractor for, all your medical needs. But to keep your back healthy or joints that you might have problems with, yeah, I think they have their usefulness. Medicine. Well, I find it fascinating that medical doctors deem themselves to be administering mainstream conventional medicine, and they refer to naturopathic medicine as an alternative medicine. There's nothing alternative about naturopathic medicine, except it's an alternative to a medicine that is frequently quite toxic, which is the medicine practiced by medical doctors, MDs, who do not understand the full impact of what they're doing with their prescription pads. Naturopathic medicine comes from a panoply of disciplines rooted in time back to anciency. Hydrotherapy probably started around the 1700s in the form of a fellow in Germany who practiced it and cured himself of arthritis by standing under cold waterfalls. And this man, interestingly, was first deemed a charlatan. He was chased out of the country. They at one point tried to murder him and hunt him down, and then later brought him back and deemed him a saint and a national hero. And hydrotherapy has actually been performed in every culture, ancient to today. It's a way of healing people. Water cures. Water is life. Water heals. That's why Standing Rock is such a huge social issue right now, because water is life. Oil is not life. Botanical medicines exist in every culture, from human culture and probably animal cultures as well, although we are also animals, from time immemorial, from the inception of the human race. The earth gives, it's part of the blessing of being on this planet Earth. The earth brings forth these herbs and these plants and these fruits and these vegetables that can heal us, whether it's through our everyday nutrition or for special purposes when we take them to cure specific ailments. Homeopathy was discovered by a system discovered by Samuel Hahnemann back in the 1800s. He lost both his children to disease, and the, quote, mainstream doctors couldn't help them. So he vowed, I will not let another parent go through this grief that I've experienced. So this incredible man came up with this discipline called homeopathy. He did, and there have been done over 4,000 provings, substances which prompt certain responses in the body. They kind of allow the cells to remember. They allow the body to remember, and the body is prompted by a small amount of the substance to fight the thing that, if given in full, the substance was given in full would actually cause. So it's a very fascinating thing, and provings are, people are coming up with more and more provings every day. Nutrition is key. You are what you eat. Clearly you are what you eat. If you put healthy fruits and vegetables and grass-fed meats and fishes that are wild and swim in the ocean, which unfortunately is becoming increasingly plasticized by corporate criminals. There's now not one space in the ocean that doesn't have plastic particles in it, but still, wild caught fish are still better for you than these farm-raised fish that are full of toxins and get the waste from the other fish and the often not very healthy food that they're fed. Organic fruits, organic vegetables. There's an argument of whether grain is good for you at all. It's a fairly recent development, a really fairly recent food in the human diet, but a lot of people also think grains, organic grains, nuts loaded with nutrition, seeds loaded with health. All these things are key to feeding and nourishing your body. However, in this world today, there are only 7 places in the world that have soil that is rich enough and nutritionally dense enough to come forth with food that will actually sustain you and give you everything you need. So for most of us, even eating the top diet is not enough for most of us, because the soil that gives rise to even the best fertilized and nurtured food is not always rich enough, and that's why naturopathic doctors use supplementation after testing the body to make sure it has everything it needs, all 21 of the amino acids and the vitamins and the minerals that it needs in order to nurture itself and sustain itself. There may be certain things that are missing in your body, and we give supplementation to compensate for that. And we use top-notch supplementation. We don't use this garbage that you find on the shelves of Walgreens and Walmarts and Costco and all these other places, or this Centrum Silver blah 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 stuff, which is frequently of no value whatsoever. It was very interesting. About 3 years ago, I read an article in the Wall Street Journal wherein our country, we spent millions of dollars for a study to come out with the result that supplements are by and large of no value. They give no added value to the American public. What a joke. I reviewed this so-called scientific study. Virtually every supplement, everything that was studied was a garbage supplement. They studied vitamin D3, but they didn't put K2 in with it, which is what you're supposed to do when you administer it. Otherwise, you can get a calcium deficit. They studied Centrum Silver, which is, in my opinion, a garbage product. They studied, it's eluding me at the moment exactly each and everything they studied, but every single thing they studied, they had given the wrong supplement. They gave calcium. You don't give calcium by itself. That's a very bad idea, an inherently bad idea. And then they concluded, based on studying all these improperly given supplements, that these supplements were of no value. Well, yeah, they're of no value if you don't know what you're doing. I agree, which is why you shouldn't go to a medical doctor. The average medical, I don't say you should never go to a medical doctor, but don't ever go to a medical doctor for nutritional advice, because most of them take 0 nutrition in school. Naturopathic doctors take at least 4 courses in nutrition, and the average housewife knows more about nutrition than the average medical doctor. So when you look at these studies that say, oh, and by the way, I went to the website that published this, and it was the Annal of Internal Medicine, and immediately I got bombarded by ads for cardiological pharmaceuticals. So, gee, I wonder who's informing this study in the first instance. Consider the source. Always consider the source, which brings me to the topic of money and the medical economy. The medical economy in this country is totally loaded. It's totally loaded. You cannot go anywhere really and just out of hand rely on what's said to you. A medical doctor, and I'm a naturopathic physician, and I'm also an attorney, so I have a unique point of view. I have a number of times gone to medical doctors and shared with them the fact that I'm an attorney and I'm a naturopathic physician, and sometimes I'm just stymied by the reactions I get. And they range from A to Z, from the most rational, reasoned, logical position. The person will say, well, here's what I can offer you, and very polite and respectful, and then they give me the gamut of what they can offer me. And sometimes it's very good. Usually I can't avail myself of it because, frankly, much of what medical doctors offer is toxic. But then you get Z, where they say, they'll look at me and they say, yeah, you're a naturopathic physician. Yeah, I don't believe in that stuff. Stuff? Excuse me, stuff? What stuff? My last response to the person who said that to me, who was an orthopedist, was, well, yeah, of course you don't believe in it because you know absolutely nothing about it. How could you believe or disbelieve in it? And that's the problem. Some medical doctors will tell you, oh yes, I practice naturopathic medicine as well as mainstream medicine. No, they do not. They have not gone to naturopathic medical school. They have not taken this incredibly, difficult added course load on top of the academic regimen that they take. They are in no way qualified to practice naturopathic medicine, and that is really an arrogant thing to say, especially these integrative medicine places. I practice integrative medicine. If somebody needs to go to a specialist, I know when to refer them out. If somebody breaks their bone, I'm not going to say, oh yeah, here, eat some raspberries and take some calcium. Ridiculous. I wouldn't even entertain them in my office. I would immediately say, go to the emergency room, go to an orthopedist, get the bone set, have the cast put on. I might then say, eat raspberries because they have a trace of arsenic and it'll strengthen your bones, and other things to help them heal. I give them Arnica montana to help them with the pain. But that is beyond the scope of what I do. Naturopathic doctors are trained in minor surgery. In some states they're licensed to practice it, in others they aren't. But no naturopathic doctor is qualified to do any kind of major surgery. If you need major surgery, then you need to go to a surgeon. But let's look at, again, the economic model that's going on here. I was just reading the AARP magazine, and it's amazing what's going on. It's amazing and frankly criminal what's going on, because I learned that 2/3 of all Americans are dissatisfied with their knee joint replacements. What is going on here? People are, orthopedic surgeons are handing out joint replacement surgeries like they're chiclets. Somebody comes, they go, oh, my knees, they're making a lot of noise, there's grinding, blah, blah, blah. Oh, okay, we'll give you new knees. They're made of titanium, they're great. And if you sit down in their office, apparently there's pictures of people going downhill and on skis, and they're doing all sorts of sports things that these people couldn't do in the first instance anyway, but they think, oh yeah, this is, because this is the doctor, he's telling me I'll be better, so they get it done. And they don't feel better. Sometimes they feel worse. Sometimes it takes them a year or two of physical therapy to get to the place where they can function. People, think very carefully before you get your joints replaced. I'm not saying that no joints should ever be replaced, but what they found is a lot of doctors do maybe 6 of these surgeries a year. So, oh, you want joints replaced? Here, I'll do it. So he makes a nice fee, the insurance makes a nice fee, the hospital makes a nice fee. You don't have to pay that much out of pocket because it's covered by your Medicare or your insurance, but you are going to have to deal with the after effects of having that joint replacement. If your joints are totally and completely shot, sometimes you have to have it done, but there are way too many of these are being done. And that brings me to the topic of pharmaceuticals. You were not born Prozac deficient. Nobody is Prozac deficient. Nobody is any drug deficient. You are not penicillin deficient. You are not erythromycin deficient. You are not Lipitor deficient. You are not deficient in any pharmaceuticals. You do not need pharmaceuticals to bring you to the level of sufficiency. It's just ridiculous the way people are handed out drugs like they need them. In most cases, not only do you not need drugs, you shouldn't have them in your body. And for example, high cholesterol, Lipitor. This is a prime example. There's a concept in statistics called number needed to treat. The studies have shown, they did a pivotal study, and it showed that it takes treatment with Lipitor of 200 men with high cholesterol in order to prevent an adverse life event, death, in one man. That means for the one man that's saved, 199 men are suffering all the side effects of high cholesterol. And in women, not a single woman's life has been saved by Lipitor. So what is going on here? What's going on here is the profit model of the pharmaceutical industry. No, I did not have a mentor. No. Right. Well, I've always wanted to be a doctor. I wanted to be a doctor from the age of 3. And I was raised in a culture where I was encouraged more towards language than I was towards science. So I think it was a dream deferred, so to speak. But the other thing is I grew up in the woods. I grew up on Long Island, and Long Island was a very non-populated place in the 50s when I was growing up. So basically I spent my childhood in the woods and by the Atlantic. So I was very in touch with nature all the time I was growing up. And then when I got to be about 19 years old, I got interested in botanicals. I started studying botanicals. And then when I got into, when I was studying Zen in San Francisco, I started reading about more about botanical medicines. I read a lot about botanical medicines. And then when I started studying Buddhism, Zen Buddhism, I started studying medicine, Ayurvedic medicine, and I discovered that there was a sutra called the Baisaja Guru Sutra, in Sanskrit that had never been translated to English. And so when I went back to Berkeley, I decided I was going to translate that from Sanskrit to English, and that would be a great contribution because I figured this was really a treasure trove of information from an ancient medicine field that I could bring to everybody. And I formulated the whole idea, and I got a lot of discouragement around it, and I was trying to take my pre-medical work at the same time as I was studying Sanskrit, trying to forge this new major, and basically it became, I think, the path of least resistance to me to defer that, because I ended up just finding out that I could finish my psychology major in 1 year and then go to law school. And I thought, well, you know, go to law school, that's an interesting discipline. It's a justice, you bring justice to people, and that's important, and it'll be so easy for me to get into because I'm linguistically, I guess gifted is the word, and I always have been. So I just thought that will just be a breeze for me. So I applied to and I got into NYU School of Law, but I promised myself at the time, if you're not happy with this, then you can always go back to your original plan of becoming a doctor when you're 40. So that was it. You do this till you're 40. If you like it, then you do it the rest of your life. If you don't, then you can go back to being a doctor. And that's exactly what I did. When I reached 40, my children were little. I applied for the special students program at Yale, and I started taking the pre-medical work, and I took it over the years as my children were growing, and then this College of Naturopathic Medicine sprang up right nearby me, and I thought, wow, I mean, think about this, Margaret. His school is 30 minutes away from you, and simultaneously, I personally and my son, I began to see horrible side effects developing in us from taking pharmaceuticals. And my younger son had got asthma when he was very little, and he couldn't take the albuterol. It just made him, he hated it. He wouldn't take it. He wouldn't take it. And the little boy next door took it once and vomited. And so he couldn't, and he wouldn't take it. And then I said, you know, what's going on with this? You know, what's going on with this? And then I developed an allergy to all antibiotics. I mean, very dangerous. I couldn't take anything except a drip IV of vancomycin. I was like, wow, I'm on my own here. If I get anything that requires an antibiotic, I can go to the hospital, get drip vancomycin, and I think that only treats gram-negative bacteria. So gram-positive bacteria, well, you're on your own, Margaret. You better figure something out. And also, then I began to realize, well, gee, why is this stuff so harmful that I'm having an allergic reaction to it? Something must be going on here that isn't evident to the eye. And that's when I started getting more into the botanicals, and I started reading about them even more and furthering my study in them. And I started going to Green Nations gatherings of plant people, botanists, you know, some amazing people who either completely self-trained or they're scientists who have become healers, and they operate completely outside of the system, which I don't really advocate. I don't really advocate that, and that's another subject which I'll talk a little about. I don't really advocate that because the public never knows what they're getting. Yes, you might be lucky, and you might get one of these rare, brilliant people who happened to have a doctoral degree in science and became an expert in mushrooms or an expert in, you know, environmental toxins, the dangers of electricity. There's actually somebody like that, Brian Drum. So you might be lucky enough to meet a person like that, or you might meet what's really out there littering the environment, so to speak, which is lots and lots of random herbalists who think they're doctors, and you go to them and you could have malaria and they'll be like, yeah, so I have just the herb for you. I mean, that's an exaggeration, but herbalists, some of them are excellent, and there are master's degrees in herbalism, and they come from schools that are accredited and different nations, and they're excellent. And others of them just dabble in herbalism and call themselves herbalists. And there are a lot of people who call themselves naturopathic doctors who are not naturopathic doctors, and for a variety of reasons. They're just frauds, B, they've decided that they're doctors and they call themselves doctors and they think they're entitled to be doctors because they try to heal people. And then there was this Clayton College, which was a very subpar online school, which was, thank God, closed down, where somebody could get a doctoral degree online and call themselves a naturopathic doctor, but they had no, they weren't, how can you, getting an online medical degree, it's ridiculous. They don't have any patients. So there's no training in dealing with patients, and that's just one part of it, and they were not accredited. There are a few accredited naturopathic schools in this country. There's Bridgeport, there's Bastyr, there's National College, and there's a couple of more. And that's it. And there are 2 in Canada, maybe 3 now. But don't ever go to a naturopathic doctor unless they're a graduate of an accredited, a fully federally accredited naturopathic college of medicine that can legally grant doctoral degrees in naturopathic medicine, and the person is board certified. We have to take 2 sets of board exams, one in the basic sciences and one in the clinical sciences, and is licensed by the state they're in. And this is another problem, which is that only 18 states license naturopathic doctors. So unfortunately, there are many states out there where there are highly qualified naturopathic doctors, but they can't get licensing. You want your state to license naturopathic doctors, because if they don't license them, how can they regulate them? And if they're not regulated, then how do you know whether or not you're really getting a fully trained naturopathic doctor? So that's another issue that the public needs to be made aware of. But it's very important in any discipline, whether it's lawyers or doctors, chiropractors, whatever field, physical therapists, whatever field a person is practicing, you have to have governmental regulation and oversight, because otherwise you just get willy-nilly self-appointed people, and the public has no way of checking their credentials, reporting them to governmental agencies if they're not comporting themselves properly, and all kinds of ethical and professional issues arise. The entire world, actually. I interviewed a number of schools when I was going to medical school. I interviewed at the Sorbonne in France, and I interviewed at the University of Beijing in China, where I was shocked to discover that A, I wasn't eligible to go because if you're older than 25, they won't take you, and B, they no longer teach Oriental medicine at the University of Beijing. That's considered passé. They only teach Western medicine. So all over the world, many of the most ancient traditions are being replaced by the pharmacological model, and I think we're in the dark ages of medicine today. I think it's really dark times. There's so many unnecessary surgeries being performed, and in our country, we just get surgery for everything. Now, surgery, I'm part Iroquois. The Iroquois were, I am not opposed to surgery. The Iroquois were the top surgeons in this country. European surgeons used to come literally and study at the feet of Iroquois surgeons back in the 1600s. Surgery has a place in the human body. There are some things like growths and tumors that can't be dissolved. Some can be resolved, some can't be resolved. So surgery has a place, just as tree surgery has a place. But the surgery that's being performed in this country, it's everywhere. I mean, it's like it's a disaster. It's an epidemic of surgery. Surgery, cut this, cut that, cut the other thing. And that's just so bad. And this pharmacological event is crazy. Yes, pharmacology has its space. The stem cell research is wonderful. Stem cells are fabulous. They're undifferentiated cells. They can grow to be anything. Yes, we have to be very careful. There's all kinds of ethical and biological issues that are attached to it, but there's a plenipotentiary possibility there of what can be done in terms of healing the human race. So it's a wonderful, wonderful thing. And there are also pharmacological developments that are very, very sophisticated that might work. Like, I just had recommended, because I have a joint problem, to have a hyaluronic acid put into my body. Now, I'm not saying I'll do it, But, you know, hyaluronic acid is something that's used. It's a cushion for your joints, and there are people who have very serious allergic side effects to it, and I will say the medical doctor who recommended it told me that there's no way I would have had an adverse effect because nobody had them, but that's not what the pamphlet that I was handed concomitantly to him making that representation. It says lots of people could have side effects and an allergic reaction, so be very careful. Read everything about something. Don't just trust what your doctor says to you. Don't just trust what your naturopathic doctor says to you. Don't just trust anything. Do your own research, but then you're not a substitute for a professional, so just be very careful about who you choose. Get recommendations, interview 2 or 3 people before you choose whatever doctor you choose, and get 2 or 3 opinions about things. So, you know, you might, for example, as I say, I'm having joint problems, so I've gone so far to I went to a orthopedist, then I went to a naturopathic doctor, then I went to a physiatrist, and I'm going to go to a physical therapist. So that's 4 points of view I'm going to get before I decide what I'm going to do about my joint problem. So you just have to do your research and your work. And also, because I'm a naturopathic physician, I've done every single thing you can think of for my joint, and that's what you do first. First, you know, I have sports injuries. Unfortunately, sports are not very good for your health. We love them, I loved them, I had to have them, I played them, and I paid the price for playing them. And so, you know, and it's part of our culture, but, you know, there's lots of things you can do for joint injuries. So, you know, do those things first. Do your, you know, medical foods, do your collagen, do your hyaluronic acid, drinking it, do your supplementations, do your homeopathic medicines, and then when that doesn't work, do the next thing. But getting back to the subject of the Dark Ages, we're definitely in the Dark Ages. I mean, look at the statistics. We are 42nd in the world in medical care. People, 42nd in the world. We spend over $4,000 per person, more than any nation in the world we spend per capita. And what we get back is the position of 42nd in the world. Something is clearly wrong here. Yes, we are in the Dark Ages. Why? Because we've turned medicine into not a right, but a privilege. And we've allowed it to become something that's subject to the profit ethic. I'm not opposed to capitalism, but capitalism does not work in the context of medicine. Any civilized society guarantees medical care to its population. We have failed to do that. We have utterly failed to do that. Yes, we had Obamacare, and look how long it lasted. We couldn't even keep it for more than a few scant years, and it was bombarded with criticism. You'd think it was a crime to provide national health care. I know there were a lot of problems with it, but the first and only time we got it, and now it's been repealed. And if you think what you're going to get back next is better, you're so wrong. It's going to be a lot worse, because just watch, you'll see. So we don't have guaranteed medical care. We're back to the most primitive state that we could be. This is an internationally recognized through all kinds of covenants and treaties, an international human right, recognized by the United Nations back in the 40s, recognized well before that in indigenous cultures. If people are sick, as a matter of common compassion and common sense, you treat them. Not in our culture. Not in our culture. So, look, the profit ethic is one thing, but when it comes to the point where people are dying, and they are dying, then that's quite another. So you have people now being treated with, let's say, cancer. This is a perfect example. People are dropping dead like flies from cancer in this country. How are they being treated? They're being treated with predominantly chemotherapy and radiation. Does it work? Rarely does it work. Yes, occasionally someone is cured of cancer with radiation and chemotherapy, but frequently they just die. And I now have seen this. I just lost my best friend from medical school to cancer. She got out of medical school, and the day she learned she passed the boards, the next day she learned she had stage 4 breast cancer. And she stayed alive for 3 to 4 years thanks to her naturopathic physicians, and she took radiation. But my son just lost, we just lost a member of our family, my daughter-in-law's family's brother in his 20s to cancer. This has just become such a everyday occurrence in this culture, and it's horrible. Now, I can tell you, you're going to be shocked by this. There is a doctor, Colleen Huber, in Arizona. She's a naturopathic doctor. She has a 93% cure rate. 93%, and that includes every person who has come to her. She puts it online. Every single patient who has come to her, she will treat them regardless of their choice of care. They could be taking radiation, they could be taking chemotherapy, and they can take what she has to give them as well. She keeps track of every patient from stage 1 to stage 4. And all kinds of people have come to her. Every single year she checks every single patient, so she knows where all the patients stand. 93% cure rate. This is the highest cure rate in the nation. Have any of you heard of her? No. Why? Why haven't you heard of this woman? You know, I said to her, haven't you alerted the media? She said, I have alerted the media. Well, the media hasn't picked it up. Why? I would like to know that. Are they, the lapdog of imperialism, as some people say? Or are they breaking their backs to tell the truth, as the managing anchor or one of the anchor persons at CBS just said? Where's the media on this issue? And there are other very fine naturopathic doctors who at the very least should be being used adjunctively. James Belanger in Massachusetts kept my friend in stage 4 breast cancer, Lucy, alive for 3 to 4 years, relatively comfortably. He brought all her markers up. Why isn't this being used? And the problem, again, with this integrative medical model that's out there, which I support integrative medicine, is that they're not practicing integrative medicine. You have Cancer Treatment Centers of America. Yeah, they have NDs on staff, but guess what? Many of them are in states where NDs aren't licensed. And so the NDs are really secondary care physicians. Now, they would argue with that. I know they're not going to agree with that position. That's just my view of it, but I don't think that the integrative care that's being practiced in this country is really being practiced, because the integrative care centers that I see involve giving yoga options to people, diet and exercise, nutritional advice that's not particularly good, and counseling. That's not integrative medicine. And that's all I have to say about that. So yes, we're in the dark ages. We're in the dark ages of medicine right now, because people are dying unnecessarily. And I think 1,000 years from now, people are going to sort of look back at horror and say, what were they thinking? Just as we look back at the medieval times, Middle Ages, when people were dying of the bubonic plague and they were hauling bodies away as this horrific time, I think that's what people are going to look back, if the earth is still here in 1,000 years, hopefully it will be, and say, gee, what were they thinking? They had so much money and they could have fixed this situation so easily, which we could fix this situation so easily. We could, and that's the next subject that I want to cover, how to fix this situation. It's not that hard to fix. The answer lies in the hands of the American public, and I'll give you an assist. If you listen to my next interview, which is, we'll have to do the date, it's 14 days from February 23rd, so figure out the date, and if you listen to the archived interview from February 23rd, I'm setting up on my website a system to bring naturopathic medical care to the public. All you'll have to do is, and if you listen to the next interview, all you'll have to do is go to my website, click, it will pull up a list of your state senator and your representative. There'll be a script of a few sentences, and it will be the telephone number of your representative. Call them up, tell them you want naturopathic medical care covered by Medicaid and Medicare, and all insurance companies in a professional services rendered manner. That's another issue that we'll talk about. But this whole exercise will take you a minute, folks. And 3.8 million people listened to my last interview. How many more will listen to my next interview, I don't know, but it could easily be 5 million. If only 20% of you, that's 1 million people, called on the same day that you listened to that interview and called your senators and called your House of Representatives congressperson, that would rock Congress, rock it, because they're answerable to you. And if you say, I want you, my representative, to personally introduce a bill into the Senate or into the House of Representatives to make naturopathic medical care covered by Medicaid, Medicare, and all health insurance providers, it's going to happen. They're your public servants. You don't belong to them to give them your vote. They belong to you. They're here to serve you, and you have the right to be served by them. They make a ton of money, and they all have medical care. And you have the right to your medical care too. And guess what? If they don't do it, kick their butts out of office. It's very simple. So I hope you will join me in doing this so that you get the medical care that you have the right to get. Well, really, their behavior has risen to a highly criminal level. First of all, if what they were doing was legal, they wouldn't have to be bribing our congressmen in order to continue to do it. So not only is their behavior criminal, but the behavior of our politicians is criminal. Oh, there may not be a book on the law that forbids it, but when I talk about criminality, I'm talking about the difference between right and wrong. And, you know, I could come up with some interesting legal arguments about using RICO to prosecute Big Pharma, because I'm sure that there's conspiracies and collusions going on there that the American public would reel with horror if they knew about it. And they should know about it, and they're going to find out about it. And when they do, they're going to be so angry, they're going to throw these pharmaceutical companies' executives in jail where they belong, and they're going to throw the politicians who are in bed with them in jail where they belong, because this is just all kinds of wrong with no place else to go. But not only are they ODing the American public, I mean, 50 million people in this country are now addicted to pain medications. What is that if not drug running? Our children are being absolutely dosed with drugs to the point where they don't even retain their normal personalities. A child is diagnosed with ADHD, therefore he needs Ritalin. First of all, ADHD as a disease, I don't even agree with that concept. They say, oh, their brains are different. Yes, their brains are different, so not everybody has the same brain. Why is it that we're so opposed to attention hyperactivity deficit? Why? Because it's a pain in the neck for the teachers. They don't like to have to deal with 5 little boys or girls, and it's frequently males, who have this alleged ADHD, because it's a lot of work for them. Well, too bad. You're a teacher. That's your job. Deal with it. That doesn't mean you have to drug addict 5 children. And for a while in Connecticut, teachers were actually reporting parents who didn't give their children Ritalin to the Department of Children and Services, thereby wreaking havoc in the family lives of these children who they allegedly cared so much about. Children have different brains, and little boys are highly active, and some little girls are dreamy, and maybe that's the stuff of visions, those dreams those little children have. So that doesn't mean that those children have a disease. That just means those children are different, and that can be a good thing. In fact, Albert Einstein was reputed to have ADHD, and another term for this alleged disorder is Einsteinian complex. So I think there's far too much disease attributed to people when there is no disease. For example, restless leg syndrome. Are you kidding? We used to sit around at our dinner table and talk about other alternative, let's say alternative factual diseases, shall we say, in the newly created vernacular. We could have a twitching eyelid syndrome, or we could have a crooked wavering finger syndrome, or you could have scratching the nose syndrome. I mean, they've now the diseases, it's laughable. The first time I saw restless leg syndrome on TV. I laughed so hard because I thought this was such a clever Saturday Night Live skit. No, it was the commercial for Saturday Night Live. It wasn't a skit. I was stunned to realize this was an actual commercial for an actual alleged disease. They have diseased everything in this culture, and now they're treating all these diseases with drugs. Of course, because these drugs are so profitable. I don't think people need most of these drugs. There are people who benefit from drugs, but even that, you know, we were talking earlier about epilepsy. Well, we now seen that epilepsy can be treated with medical marijuana. Well, why would you want to treat epilepsy with Dilantin, which has numerous side effects, when you could treat it with medical marijuana, which does have side effects? It depletes the vitamin levels in your body. It arguably impairs motivation. People tend to, apparently, when they take a lot of medical marijuana, have less motivation. It has side effects, but I don't think you're going to find them anywhere compared to the level of side effects that you will most probably see with Dilantin. And I wish people would read these handouts that come with these drugs. If they read them and they thought about them, they wouldn't take them. They're so dangerous. They're so toxic. I got a few weeks ago for bronchitis. I tried every naturopathic remedy. I said, well, let me go to my MD. I got Tessalon and Mucinex. I got so sick, I thought I was going to die after taking 3 doses. I called my doctor. She said, I've given that to hundreds of people. I've never seen that reaction. Well, I said, well, you just saw it and put it in my record. And so the fact is that, you know, and that was something that people allegedly take all the time. And I'm sure, and my doctor, by the way, my medical doctor is a wonderful doctor, you know, but that's what happened. And there are now, and this is what I want to say, and this is serious business, people, 200,000 people a year die from properly prescribed pharmaceuticals. And why is it that you don't know this? I'll tell you why. Because it was not published in the United States of America. Did the New England Journal of Medicine, our premier journal of medicine, print these highly important results? No, they did not. Did any medical journal in the United States of America print these results, which happen year after year after year? No, they did not. Who printed it? It was printed in the Oxford Journal of Medicine in Great Britain. That's right, it had to go out of the country in order to be made known and then enter back into the United States through a foreign publication. Now, if that isn't suppression of journalism, I don't know what is. Clearly, this is a truth that the big pharmacological companies, the big pharma, I call it, wants to hide. They don't want you to know they're killing you, and they are killing you. And they don't really want you to focus on the side effects. The only reason they state them on TV is that they're required by law to state them. That's why they state them. And they've been stating them so long, apparently none of you are listening to them anymore, because usually one of the side effects is death. I mean, if I came up to you and said, here, have this lovely cookie. Oh, by the way, it might kill you. Would you eat it? But no. Because you go to a medical doctor and they pull out the prescription pad and go, take this, and then you're handed a pamphlet, which you don't read, and it might kill you. Will you take it? Yes, you have and you are. And even if it doesn't kill you, it's got all kinds of other toxic effects that are accumulating in your body and in your cells. And now talk about the abuse of the American public by Big Pharma. Look at what's being done to old people in nursing homes. I used to belong to a volunteer service with my church, Visitors to the Homebound, and I went and visited this couple. The woman was in her 80s. She was taking 10 different medicines. I kid you not. A doctor actually gave this poor woman 10 different medicines. I mean, I was appalled. If I took 2 medicines or 3 at the same time, I'd be dead. Here, this woman, more fragile, elderly, is being given 10 medicines. This happens all the time to seniors who trust their medical doctors, and the medical doctors don't even necessarily know what the other one is doing with the other, and they may have two different pharmacies who might not necessarily know. There's been more coordination of late, but so what? You can't give multiple medications to people and have them all work together well. Yeah, well, your doctor will tell you, oh, there's no problem. Yeah, no problem for them. They're not taking it. But does the average doctor take 4 to 5 to 6 medicines at the same time? If they do, they're nuts. And I don't think most of them do that. You know, it's like the tobacco executives who got up and swore before Congress. 5 of them. Oh, I don't believe that tobacco is damaging to the American public. P.S. None of them smoked. Okay? This is very dangerous. And let me talk about off-label use. Prozac. And this happens with, you know, so many drugs. Or Lipitor. So many drugs this happens with. First, Prozac for depression. Next, you're looking at, they're prescribing you for this, that, and the other thing. They have the patent, they want to exploit it. People stop taking it because it's been replaced by better, more effective antidepressants like Zoloft and Lexapro. So they start hunting for the off-label uses. The FDA approval was done on tests that designed to measure the effectiveness of Prozac for depression, not for off-label uses. So you're no longer getting your FDA protections when you're subjected to this for off-label uses. This is really dangerous. Let's talk about Sandy Hook, where that poor boy, Adam, you know, everybody has vilified this child, and he's a mass murderer. He committed mass murder. He was not a mass murderer. He was a boy who a week before he did this was given a new drug to treat him for his, quote, mental illness. I don't even believe in mental illness. I think mental and physical illness are just flip sides of the same coin. But he was given a drug and it turned him psychotic. And everybody wants to blame his mother and him. No, you want to blame someone, blame Big Pharma for manufacturing a drug and saying, oh, you can give him this. And I think he was given possibly 2 things at the same time, and it drove him insane. That's why Sandy Hook happened. And so these are things that you can put an end to. And the first way you put an end to it is when you go to your MD and they give you a drug, you look them in the eye and say, why are you giving me this drug? What is this drug going to do for me? And when they tell you, say, is this going to cure me? Or is this just going to treat the symptom? And I'll tell you right away, it's not going to cure you. It's just going to treat the symptom, and it's going to mask the symptom. The symptom is there for a reason. The symptom is telling you something's wrong. You need to honor that symptom and go to the root of your illness. The root, you've got to get to the root. Why is this actually happening, as opposed to suppressing the symptom? You suppress it, it's just going to pop up somewhere else. Take drugs, guess what you're going to get? You're going to get the side effects of the drugs, and that's going to be your new disease. You're not going to cure anything. So I think that's what I want to say about, oh, and the other thing about Big Pharma is when they're not busy torturing the American public, and again, I'm not throwing the baby out with the bathwater. There are pharmaceuticals that are highly advanced and sophisticated and useful, such as anesthesia. I wouldn't advise anyone to go into surgery without getting anesthesia and being put out. Not a good idea. So that's what Big Pharma is doing here in the US of A. Let's examine what they're doing around the, oh, and let's examine a few other things they're doing in the US of A. They're holding you captive. Gee, we have an EpiPen. This EpiPen can stop your child or you from dying when you have an asthma attack. Let's see. We've got a patent on it. Gee, let's see. Let's up the price of this EpiPen to $800. So, oh, you make $10 an hour and you work 40 hours a week. Oh, that's 2 months of your salary. Give it to me if you don't want your child to die. By what standard of a civilized society is that legal? And what congressman in his right mind who's saying they're serving the American public would agree to that? No, this is criminal conduct. And this is happening all over the world. HIV, AIDS. Africans were dying by the millions until pressure was put on Big Pharma to supply the drug to people cheaply, which they were quite able to do. Folks, they're making a killing off of you. The CEOs of these Big Pharma companies are making a killing, and they're doing it on your back. Just tell them no. You don't want to take these drugs anymore. You tell your MDs to take you off these drugs. And you know what? they're going to not know what to say because they don't even probably know how to take you off the drugs. And besides, they have nothing to replace it. They have nothing to replace it. So these are issues you should be confronting your doctors with. I'm not saying there aren't many very fine medical doctors out there. There are some very fine medical doctors out there. But you know what? Their training is all wrong. They've been trained in a medical model that does not work. And the ones that are waking up and discovering this are quite dismayed. And they cannot even practice naturopathic medicine because A, they're not trained to do it, and B, their insurance doesn't cover it. They're only covered if they practice within their model, the commonly accepted conventions of their discipline, and naturopathic medicine is not one of them. Therefore, they cannot get professional liability coverage. That leaves them with nothing but a prescription pad. And that prescription pad is going to kill you. So know that, people, know that, understand that. Some of these people are, you know, fabulous human beings, and they are also trapped in this medical model. So that's important to know. And also, Big Pharma is not limiting their predations to our culture. They're taking it, and they're not limiting it to the Africans who suffer from AIDS the Africans who suffer from AIDS, but they are bringing it to cultures all around the world, and they are destroying indigenous cultures that heal people. They're destroying them. For example, I did a medical mission to Nicaragua, Isla de Ometepe, where the average person, family of 4, makes $2.64 a week. And I went into the clinic there, and the only thing they were giving most of the people there were antibiotics. That was a cheap thing for them to give, and they were giving that to those people. Meanwhile, they've got plants. You could give them seeds for almost nothing. They could be growing plants to heal themselves, and you could be giving this to people all over the world, seeds to grow these plants to heal themselves. And this indigenous medical culture already exists in most of these countries, and yet it's been wiped out. It's been wiped out. And the final thing I want to talk about is vaccinations. Vaccinations are a very, very personal decision. If you don't give your child a vaccination and they get the disease and die, you're never going to be able to forgive yourself. If you give your child too many vaccinations and they get autism, you're never going to be able to forgive yourself. So you need to look very, very carefully at the subject of vaccinations and do your research. The first starting point that I recommend is to read the book Evidence of Harm by David Kirby. It's a very intelligently written book about vaccinations, examining the whole picture. And there are doctors who will tell you, you're absolutely irresponsible if you don't do these vaccinations. And there are doctors who tell you, well, you might not want to give all the vaccinations. I just think you should consider that when I was a child, I got a vaccination for polio. I don't remember getting a vaccination for anything else. I got the chicken pox, I got the measles, I got the mumps, and I'm here to tell the tale. I would not have liked to get polio. My little girl next door I was friends with got polio, and she was crippled for life. However, some people looking at the polio statistics say the polio vaccine actually caused more polio than stopped polio. I won't be the judge of that, frankly. If my child was at risk of polio, I think I would have given my child the polio vaccine. I think it's a very personal decision. But the difference is, I got a handful of vaccinations when I was a child. Today, they're imposing on children up to 80-some-odd vaccinations in a short period of time. These are infants and small children. They cannot sustain this assault upon their body. I believe this is absolutely a terrible idea, to be inundating these small, vulnerable children with a plethora of vaccines. And again, it's the profit ethic at play here, because what are the chances that most of these children are going to actually get the diseases that they're being vaccinated against? So what I think is, pick out the most dangerous things, pick out the things your children are actually going to be subjected to, and then decide how you want to handle it. It's a personal decision. The government should not be involved in this decision, and they are involved in this decision, and they're doing terrible things to certain parents around the issue of vaccination, saying, oh, you're being a negligent parent, you should vaccinate. And then there are people say, oh, you're exposing my child to this by not vaccinating. Hey, it's a personal decision. That's why they call this the land of the free. I question how free we really are, but that's why we call ourselves the land of the free, because we have the right to choose. So choose wisely. Take care of yourself and rely on yourself, and make the right decisions of others that you rely on to take care of yourself. Take care of your body. Your body is your most precious treasure. Health is wealth. Health is the primary thing in your life. As long as you have your health, really nothing is lost. Everything is resolvable and returnable. Treasure your health and understand that your basic nature is health. Your basic nature is to be healthy, and you can be healthy. Just be very careful about what you eat, the exercise that you take, the company that you keep, keeping the toxic load down low in your body, being out in the fresh air, being by the ocean, being by the forest, being by the streams. Surround yourself with nature. Stay away from crowded cities. Or if you're in a crowded city, make sure you get exposed to the countryside as much as you can, and enjoy your life, and God bless.